ADAP funded next fiscal year, assuming sequestration keeps going.
Okay, I'm going to introduce you to Margaret Donaldson. She is the program and budget analyst for our department in the budget office, and she is handling our budget questions today.
Good morning. Thank you for your question, but I don't have a direct answer for you. We're not sure. What we're trying to monitor very closely are a set of variables of which we have no direct control. You referenced the federal sequestration. There are other possible federal changes that may affect what happens with the budget and how we need to monitor and implement the program.
So, a follow-up to that, we are meeting with people who are looking for this information, and we want to get it to them so they can do, what they can do. What is the next step with that?
In terms of
getting the information and getting it to the people who are making the decisions about the budget.
just that we need to all pay close attention to what's happening on all those levels. We have several things, again, federally, that affect many of our programs that all we can do, because we don't have a crystal ball, is monitor them very, very closely. So we're trying to keep track of everything that may possibly happen and occur over the next few months to a year. But dollar figures, I'm not able to give you anything specific that would be helpful or that would be correct going forward. It's kind of an ever-changing situation dependent on, again, those federal changes, the uncertainty that we have there, and the fact that enrollment and the growth in enrollment is not a constant in terms of it just doesn't stay at one level. So those are the factors that we're all having to deal with.
I know this is a really, really difficult question for you to answer, but if we were to take the number of people currently enrolled in the program today and try to figure out how much it would cost to pay for that for the budget year that our legislators are writing, do we even have that kind of a number? Because I think the legislators, they're going to do something and they need a number. So is there any number how much does it cost to run today's program?
And you can't answer the question here, she needs the light. I'm sorry, the question is, it is really hard, but I know that we'll probably be asked this question by legislators, and so I'm wondering, is there any way to say, if we ran the program as it stands today for the next 12 months, how much it would cost to run the program for that period?
I don't have that answer. Jacqueline, do you want to supplement anything to that? We can't answer that right now, and I know that's frustrating.
Have there been any projections at all within the to answer Allison's question? Have there been any numbers run to look at what it would cost to run the program as it is today? I mean, I know there are a lot of variables. We don't know about sequestration. We don't know about the continuing resolution, all of that. But has anyone in the state run the numbers, at least some projections? I mean, because this is really, we're all going to talk to legislators and we don't have any figures. And it seems to me that those figures somebody must have looked at what it would cost to run this ADAP program.
I think those kinds of projections are done constantly, as a matter of fact. We're constantly trying to monitor the program, both on the program side, the budget side, and all facets that may be valuable and helpful.
So what do those projections show?
I can't answer because it's a moving target.
What are you saying to legislators when they ask you, we're facing a potential $8 million cut. We're advocating against that. So when legislators ask you, what do you say?
I would say that they need to help us to continue to monitor and assure that we can look at these numbers carefully as we get more answers going forward.
So how do you budget?
There is a current budget that is being implemented, and we will continue to monitor to see what adjustments have to be made to that budget.
We need the 8 million? Do you think we need the 8 million?
What, are you talking about the proposed reductions?
Yes.
The proposed reduction was the proposed reduction was based on the level of unspent dollars over the last 2 years and what may be unspent this year, varying or not knowing what other factors may come into play. That's what that reduction was proposed based on, was the unspent money over the last 2 years.
I'll just ask one more and then I'll stop. Does that proposed reduction take into account the fact that we were not able to increase eligibility to 300% or expand the formulary until the end of the fiscal year, thus leaving money on the table that could have been spent if we had been able to make that expansion earlier?
It was based on the unspent dollars left on the table.
I want to thank everyone.
Hassan? Yes, I want to thank everyone from the Department of Health and Human Services for coming out today. I also do want to return to the question about the budget, because we do certainly understand that this is a very complex projection. At the same time, we know that the process that was used in the governor's budget was very simplistic. We know that at the time that those funds were reverted, there was a 265-person wait list. We had the lowest eligibility in the country, and we had a reduced formulary. Those are not the conditions we want to see for ADAP in the future. So we really want to know what level of funding we need to keep ADAP open and operating the way it is today, where we're serving that need so that people are in care, so that we can get those virally suppressed patients and stop the transmission of HIV. Is there something that we can do to help you get us the answer?
I think you're probably already doing it. You're staying in close contact and you work with the program staff. Again, I don't have a crystal ball today. I wish I did. We are just closely monitoring everything that we can possibly do to get some more specificity going down the road. But I do not have any other direct or specific or detailed answers to provide today. Just that we are all faced with uncertainty, and then it's not just this program, which is critically important, but we have other critically important programs that we don't have the specificity we need to plan for those or know exactly what may happen with those as well, primarily due to federal uncertainty, but other factors as well, depending on what those specific programs are facing.
Well, there are a lot of folks in this room today who themselves have relied on ADAP or who serve people who relied on ADAP, and I have to speak for them and say that it is a matter of life and death to make sure that they can count on that.
Absolutely.
Thank you.
Thank you.